I'm Rob Siemens in the Department of Urology. Most of my research is focused on GU oncology, mostly prostate and bladder cancer. And I've been working with a core group of principal investigators in the departments of biomedical and molecular sciences, as well as pathology and oncology, some for the last 20 years or so. Our research goals have more narrowly focused as a group on bladder cancer over the last decade. Bladder cancer is increasing with our aging population. It's a cancer commonly diagnosed in the elderly. And in fact, for those over 80, it equals the incidence of prostate cancer. It also represents the most expensive cancer to manage per case, given the high recurrence rates and the expense of adjuvant therapies, and also represents the most expensive in terms of caregiver costs and burden, given the intensity of care. Concerningly, as recently outlined in some data from Ontario Health, the age-adjusted relative survival is decreasing for bladder cancer compared to all other cancer sites, which has been generally improving over the last 2 decades. Now, the majority of bladder cancer diagnoses are non-muscle invasive and represents a window of opportunity to prevent progression to a more lethal state when it invades deeper into the muscular layers of the bladder. BCG immunotherapy, the microbial vaccine used for tuberculosis, has been the gold standard for us to reduce the burden of frequent recurrences and progression for the last 50 years or so. And interestingly, BCG for bladder cancer was first tested here in Kingston by my mentor, Alvaro Morales, with his first publication in 1976. Despite its use in the clinic for such a long time, we still don't have a complete understanding of how BCG helps equip the patient's immune system to fight off any residual or returning cancer. So our teams have been investigating both cancer-specific as well as patient-related causes for failure of this immunotherapy, with the ultimate goal of finding new biomarkers that will help identify who should continue with this treatment approach, and to be more precise in recommending other management strategies, as well as discovering new therapy targets to reduce the burden of frequent recurrences and progression to more lethal cancer. I'm very grateful to SEAMO for this established research award. It comes at a very unique time with a lot of momentum going towards bladder cancer research nationally and internationally. The award will specifically allow ongoing biobanking work for bladder cancer patients, both tumor and blood samples, to investigate the mechanisms of failure of BCG immunotherapy and support some work we are doing with Marathon of Hope Cancer Center Networks from the Terry Fox Research Institute.